Tim is with the Department of Public Instruction with mental health, and I'm just sort of going to let you take care of your own introduction there, Tim, because, well, gosh darn it all, I've had you speak before, and I know you can handle it. So, Tim, if you would like to go ahead and start your screen sharing, and go ahead and take it away. I appreciate you being here. Thank you so much. I know that you are coming from us from an undisclosed location. So we won't tell people where you are, but we know that you are on the road, and we thank you for being here today.
All right, am I unmuted, and is my screen share appropriate, or does it look funny? Do I need to hide some things?
No, I think it looks good.
Okay, you're not seeing my speaker notes, just the slideshow?
Just the slideshow, sir.
All right, fantastic. So as Tim mentioned, I will disclose my location. I'm in Denver at the National Association of School Psychologists annual conference. So I'm at a few disadvantages this morning. One being I don't have my dual screen, so I'm not sure what you're seeing. I'm not going to be able to look at the chat. So if somebody's monitoring that for questions, Katie perhaps, or whoever, feel free to jump in and stop me if there's a question you'd like me to address or anything like that.
I'll totally interrupt you, Tim, if you can hear me. So I got you back.
Excellent demonstration, Katie. Thank you. Very good disruption. I'm also working with hotel internet. I did pay the $5 to upgrade the connection here in my room, so hopefully that works out okay. And you might also notice my voice is a bit scratchy. I don't know if I caught some sort of bug on the plane. I was wearing a mask when I traveled. So it might just be the dry mountain air here in the Mile High City. The other sort of disadvantages I have is I've got a big topic to cover today. In about 45 minutes, I believe, is the time that I have. So I am going to go through a whole lot of information, probably pretty quickly. I have not yet sent my slide deck to Tim, but I will do that for him to disperse to everyone attending today, which includes different links to different resources and information that I won't have time to go into detail with today. So anyway, I was asked to come to talk about sort of the nexus between mental health and autism spectrum disorders and developmental disabilities. I am going to just often probably just refer to autism or ASD, just in the interest of time. So that's just going to be a shorthand, but just recognize that when I say that, the things I talk about certainly apply to children with other developmental disabilities or children all along the autism spectrum. So I will try and get through this information as quickly as I can. If you have questions, I don't know if the question and answer feature is turned on. It looks like those things might need to go into the chat. And as Katie said, she'll keep an eye on the chat, and she is not shy about interrupting me. So if there are questions that pop into the chat, I'm happy to answer them. It's often easier to do it as I'm going in the moment when I mention something rather than saving them all for the end. So don't be shy about putting questions into the chat. All right, here we go. So why are we here today? What I'm going to be talking about are several different sort of pretty broad topics. But I want to start with comprehensive school mental health systems. The reason for that is whether you have autism spectrum disorder or any other IDEA identified disability, or if you are neurotypical, elements of comprehensive school mental health benefit sort of everyone in the community, in the school, as you can see here on this slide. So the main question here, why are we here? These elements, why would we work towards a more comprehensive school mental health system? I know there is still some common beliefs and resistance out there that, schools are for the 3 R's and they should be focusing on academics, and we're not. Mental health centers But we know there's a link between mental health and wellness and academic achievement and all the other outcomes, positive things that we want kids to get from school. So the big question here is what are our goals as an education system? And they need to include things around mental health. This system includes parents, families, caregivers, community agencies and organizations. It's so cool to see so many community organizations that Tim listed today who's here. It includes out of school time programs, either run by the school or run in partnership with school. The key thing to think about when you're thinking about what are our goals as an education system is perhaps the goals of the school aren't going to align perfectly with your goals as a parent or the goals of a community organization, a boys and girls club or an after school club, whatever it might be. They don't need to align perfectly. Where we run into problems when we think about comprehensive school mental health and how we meet kids' needs is if those goals are at odds. And I think that's a lot of times what we run into when we run into conflicts or struggles to truly meet kids' needs. So for this audience and this topic today, a really good example of that where the goals may not align perfectly, but you need to ask what are our goals is we know there's a difference between how IDEA, the Individuals with Disabilities Education Act, identifies or defines autism as what a community-based clinician or psychiatrist or psychologist may diagnose as autism. The goals for parents, therapists, whoever, and the schools in these cases may not align perfectly or may not match up perfectly, but they're certainly aligned. So it's important to ask that question within the system to make sure that those things are clear and then we know how those things overlap and where there might be gaps in supports and services and things because they need to line up. When it comes to mental health and autism, I want to caveat some of this data that I'm sharing that you see on the screen here with prevalence rates are kind of tricky to pin down, particularly among children, for multiple reasons. A lot of times these studies and things that get done have to pull different data sets from different sources that use different criteria, such as when we're looking at prevalence rates of autism, are we looking at IDEA identified children with autism or DSM-5 or other diagnoses of autism? So trying to stitch those things together. So, but as you can see here on this slide, it does give us a sense, maybe it's not an exact identification of the prevalence rates, but what seems clear here is for children with autism, it's more the norm than the exception that a student may have some sort of mental health struggle, even an identified mental health disorder. So as you can see, rates of depression, anxiety, OCD, eating disorder, all those things. A lot of research out there is sort of aligning. You see that 70 to 78% range of children with autism somewhere during their lifespan may experience some sort of mental health challenge. So it's also, I want to acknowledge, again, I'm going to be talking about students with autism as just sort of a shorthand. And I do want to acknowledge that like what this slide shows sort of is what's starting to become more commonly referred to as intersectionality. So a label or an identification or a diagnosis of autism doesn't fully define who an individual is, nor does a mental health diagnosis. Those two things are just two pieces of a larger puzzle that make up who an individual might be and how they move through this world. Another example of that are those cultural factors. So language, dual language speakers, things like that. There's lots of different things that make up an individual in addition to sort of these labels, and they interact and they overlap and they are important for us to think about. But obviously for our purposes today and in the time that I have available, I'm really going to try and focus more on this autism and developmental disability aspect, and where that intersects with autism, where that intersects with mental health and wellness in the context of school. So this slide is a fairly long quote, and it just sort of summarizes some of the research on autism and mental health diagnoses, and gets a little more at sort of what the outcomes for these individuals often are. And as you can see, compared to neurotypical peers, students with disabilities, and this encompasses IDEA disabilities, not just autism, but these students experience higher rates of mental health challenges, more anxiety, depression, academic distress, things like that. Students with disabilities attempt suicide more frequently and engage in non-suicidal self-injury or self-harm. They're at higher risk for peer victimization or bullying. And that's particularly relevant with autism, knowing that it's a social language disorder, because often those cues, those sort of nonverbal and more subtle things involved in bullying maybe don't get recognized, so it can go on for longer. It can feel more chronic for these students. So this really gets at sort of more of the outcomes. So why are we here today? It's really about this, where outcomes for these students really need to be sort of at the forefront of our mind when we're thinking about what sort of services need to go in an IEP, what sort of things we need to do when we're conducting our evaluations. So how I'm going to attempt to do that this morning is try and tie together several different sort of models and structures that we provide or we offer to schools as supports, to sort of look at how all these systems interact and overlap with each other, and try and think about ways where these things really shouldn't operate in silos. What's going to benefit kids the most is if these things are operated and integrated and are more seamless. So many of you in the audience, I suspect, are caregivers or parents of children with developmental disabilities. So right now, I suspect many of you in your community, in your school, in your family are you sort of operate as those arrows that you see on the screen. You're sort of the thread that has to try and make those things seamless. And I want to acknowledge how exhausting and tiresome that can be, and how hard that is. So you already know, as parents, oftentimes how difficult it can be to sort of connect these systems. It's not just looking at something like this and saying, okay, I'm just putting this, two-dimensional puzzle together. It's more of a Rubik's Cube where it's complicated and it's three-dimensional. So I say all that because, one, I want to acknowledge parents and caregivers that are here this morning that have that lived experience and are currently living that experience. But also just to say that in the short time that I have, I will try and go through these things sort of as separate things and sort of sequentially, but I'm going to meander a little bit because these things do need to overlap. They do need to tie together and be seamless if they're going to be effective for kids. So what you see today on our left is our state Department of Public Instruction model for our equitable multi-level system of support. It's our version of the newest evolution of what you might be familiar with as RTI, or response to intervention. It's a framework for schools to really provide the right services and supports and have the right systems in place to get students what they need when they need it, with equity at the center. The things I'm going to go into a little more detail on today are that top symbol that you see there, those puzzle pieces, that sort of that represents our comprehensive special education evaluation model. What you see in the bottom center there is our comprehensive school mental health framework. I'll go into a bit of detail on that. And what you see on the right there is our 5-step process that we refer to as the college and career ready IEP process. So as you can see, all these things sort of tie together and need to work together and need to be seamless if we're going to meet the mental health and developmental disability related needs that so many of our students with autism and developmental disabilities have. This slide is simply just a link to all of those visuals that the main pages of all those visuals that I just went over on that last slide. Our multi-level system of support, our comprehensive evaluation framework, our school-based mental health framework, our CCR IEP process, and just an FAQ document, which is particularly relevant today, again, looking at the nexus and the overlaps between mental health needs of students and special education services. All those things happen on this continuum of support or continuum of services. And we have a FAQ document that sort of addresses that, with the main idea being when a student or a child needs specially designed instruction through an IEP, meaning they meet IDEA criteria and have a demonstrated need for specially designed instruction, that doesn't suddenly mean that student gets moved over to this separate system of services and supports. Those specially designed instruction and the accommodations and modifications are in addition to all of those other things in an equitable multi-level system of support, all those other services, all those other things in our comprehensive school mental health system. They are in addition to, they are not in place of those services. So what I'm going to try and do today is tie these things together as best I can in the short time I have. So I want to go over this first, because outside of that really broad umbrella of our equitable multi-level system of support, within that, when we think about special education and mental health needs of students and students with disabilities who have mental health needs, this framework sort of needs to be the foundation. Let me rephrase that. It doesn't need to be the foundation. It's ideal if this is the foundation. If your school system, if your school district system is built on this foundation of comprehensive school mental health, you get all those benefits that I went over on that earlier slide about the benefits to students and staff in the community when components of comprehensive school mental health are in place and operating efficiently and effectively. So this is the foundation, because these core components that you see on the screen here, the continuum of supports and the collaboration between staff and families and community agencies and community members, conducting needs assessment and resource mapping to identify what your school and community and individual students' needs are. All of those things are the core components that are going to impact all levels of service and support, from that universal level, the curriculum that all students receive and participate in, down to the individual student level. A good example of that when it comes to this framework is schools and districts that have sort of a solid mental health referral pathways. Schools can be great places, but not all schools, or schools are not necessarily designed to meet all mental health needs. It needs to be a collaboration between schools and families and communities and partnerships. And sometimes that means outside resources that are needed to meet a student's needs. The other reason this is the foundation that I'm going to talk about before we get into the special education side of it is that this is a real culture shift for schools and communities. And I'll get into what I mean by that in a few slides. So if you think about it as our multi-level system of support is sort of our big, broad vision, this might be considered sort of the mission statement, or what would be revolved around a mission statement. So the things that we want to address the mental and behavioral health for all students, this is what we're striving for. The other two areas that I'm going to touch on today, the comprehensive special education evaluation and the CCR IEP, are just two sort of pieces of this puzzle. Or maybe when you have that mission or that vision, mission, the CCR IEP and the comprehensive evaluation frameworks might be sort of considered goals or action steps that are those tangible things that can move towards this mission and vision that I'm sort of describing. And the reason, again, final reason this is a sort of the foundation for Vermont is there's piles and piles of research to support the idea that meeting students' social emotional learning needs and their mental health and wellness needs and focusing on those things has an impact on all different areas of what we consider successful schools. So that's everything from academics to graduation to relationship to post-secondary outcomes. We know mental health and wellness and focusing on social emotional learning impacts all those things. So that's why I'm starting with this as our foundation. When we think about mental health and wellness and thinking, well, schools are not places, schools are places where kids go to learn, to do math and learn about literature and learn social skills and things like that. Schools are part of communities, and communities are part of our broader culture and society, obviously. So we're learning more and more all the time about things that influence our mental health. And one thing that we know for sure that this slide sort of represents is mental health disorders, mental health challenges are not just, the result of, brains that are wired different or things that are internal to individuals. Mental health is impacted by so many things. The economic stability of a family or community, both broadly and at the individual level. So things like housing security. If you are living paycheck to paycheck and not sure if you can pay your rent, and you're living in a world where you're not sure if you're going to have a roof over your head next month, that's certainly going to impact your mental health and wellness. Education quality and access. So we know, we've known for decades, how powerful a high school diploma and a bachelor's degree and graduate degrees. We know access to those things, the further and further along, opens doors to better opportunities, more opportunities, all these things that sort of feed into a quality of life that impact our mental health. Social and community context. Communities with high levels of community violence, or communities that maybe don't have access to you think about food deserts, where places that don't have access to good healthy foods for kids and families, that impacts our mental health and wellness. It impacts our physical health, getting into the healthcare and access, which in turn impacts our mental health. So we talk a lot about on our SSPW, our Student Services Prevention and Wellness team, when we work with districts and we work with other stakeholders, about mental health isn't just the absence of having a mental illness. It includes well-being. It includes all the things you see on the screen here. It's not that, mental health isn't this binary thing where you either have a mental illness or you're diagnosed with a mental illness, or you're mentally not well, or you're not. That's not a binary thing. That's not how it works. It occurs on the spectrum. And, we see this in our own lives. When we feel better, we do things better. I mentioned my, scratchy throat and my jet lag. When we feel better, we do things better. And that includes everything. We do everything better. So mental illness, as an example, to use actual mental illness as one of the more extreme examples, you think about, we know that having depression isn't just feeling sad. When depression sort of in its cycle or in its development and how it manifests, when it gets bad or it gets really hard, it can be paralyzing, to just get up and do basic things. It's hard to get motivated to do things. But if you don't have depression, you still know what it feels like when we're feeling like we're in a bad mood. And just like it's not just feeling sad, depression, anxiety, those things aren't just, being in a bad mood. It's a very different experience. But for me, being in a bad mood, it's harder for me to get motivated to do things. It's harder for me to complete basic tasks for my job and for my family and in my house. It's harder for me to keep my irritability in check and keep my patience with my 2 kids and tend to our relationships. So again, mental health is not this binary thing where we either have a mental illness or we don't. It's a spectrum, and it includes all these things that we want for people and for ourselves. So I mentioned depression and bad moods and things, but the flip side of the coin is it also works in the opposite direction. Positive moods and positive emotions can have the opposite effect. When we're feeling good, we do things better, and we're more motivated to do things, and we're able to do things more efficiently and effectively. In fact, there's a whole line of psychology dedicated to this idea that's called positive psychology. It's a thing, and it can have a real impact on how we move about this world and how we approach and think about mental health. So digging down a little deeper, when we think about schools and we think about our comprehensive school mental health system, the reason understanding that mental health includes this idea of well-being, again, is because of that non-binary nature of mental health. Mental health and wellness and well-being exists on this continuum that you see on this slide. That would be the sort of outer circle, those arrows that you see on the slides. What we strive for at schools within our comprehensive school mental health systems is recognizing that that's a continuum, and that us as adults, but particularly kids, can move around on that circle, that outer circle of this continuum of mental health and wellness. So our services and our supports and the things we provide through schools need to match that. We as adults move around within those different sections of that continuum of mental health and wellness. And if you think about kids whose brains are still developing and they're still learning, and they can actually be particularly volatile in terms of moving around on this continuum. So we need our systems to sort of match the right supports to the needs, both at the universal level. So what are we providing to all of our kids? And kids who are struggling more need that additional support. We want to make sure that those right supports are in place, and it includes all those things that you see on the right of the slide here. Universally promoting mental health and wellness through the things that you see there. Providing early interventions, making sure treatment for kids who need it, families who need it, wraparound services are there. That's where that referral pathways comes in. And then, of course, like in the most urgent situations, having a system where, a crisis response that can literally save lives needs to be in place. Excuse me. So what this requires, this implementation of a comprehensive school mental health system, it requires a perspective shift, possibly just within the walls of the school, but probably more likely at the community level as well. So I've spent a decent amount of time so far possibly preaching to the choir about the importance of mental health, and if that is the case for you, I apologize. But it is important to understand this foundation, this comprehensive school mental health foundation, because it requires a shift in how we think about mental health and wellness. Kids are going to come to school as they are. And oh, by the way, the adults who work in that school, who provide supports in that school, who volunteer in that school, who interact with that school as community members, they also come to all of those things, the school plays and the sporting events and the club activities and things like that. They come as they are. So the statements on these slides may sort of seem obvious. I suspect a lot of you listening right now have been beating the drum for years about behavior being communication, particularly for those students on the autism spectrum or who have developmental disabilities that aren't able to communicate verbally. That the idea that we should use discipline to teach and not to punish is important, that mental health is an asset. It's a thing that we all have, but we have this stigma around mental health and fear about talking about it. That's certainly not the norm yet in a lot of places. And then, thinking about like discipline, using discipline to teach, not to punish. There's a good amount of inertia in our educational system that still sort of view mental health and child behavior as something that's internal to the child, and we need to fix them. That they're kid-centered problems, or that they're kid caused problems, and that's just not the case. When it comes to, I'm going to try and stay off my soapbox here, but when it comes to that discipline to teach and not to punish, I mean, our myths and confusion abound in our discipline practices when it comes to seclusion and restraint, suspension and expulsion. We just need to undo, and we need to have these comprehensive mental health frameworks and systems that include discipline practices that teach kids. And just one myth that I think may be particularly relevant to this audience and this topic when we start to get into special education and evaluations and IEPs is that myth out there that kids with IEPs can't be disciplined. There are certainly under IDEA some protections that caregivers and parents and students have when it comes to discipline, and rightfully so. So it's not that kids with IEPs are not able to be disciplined. It's that we want to make sure that that discipline is appropriate and is meeting those students' needs. So it's one I hear a lot that I just wanted to touch on. So within our multi-level system of support, needs to be that foundation or that structure of comprehensive school mental health built upon sort of these perspectives that you see on the screen here about we're trying to fix and adjust the system to meet kids' needs. We're not trying to fix students. And so that's where those tools and those parts of the system, collaboration, continuum of supports, those things that we match kids' needs, that we have appropriate referral pathways. So again, we're providing those wraparound services and those things for students when they're not in school and when they are in school. Kids with special education needs, kids with mental health challenges, those things don't disappear or appear when they walk through the school doors in the morning or when they leave the school doors, that they're, again, thinking about intersectionality, that those are things that are part of that student regardless of where they are. Okay. So perhaps so far you are maybe thinking about some things when it comes to comprehensive school mental health. Maybe you've just been nodding along with me that this stuff's obvious. Or perhaps you're thinking, boy, these are some wonderful aspirations you've shared with us. But how do we go about doing it? So the next few slides are going to go over some promising practices and things that are some supports and structures and information and assistance for schools and communities to use to really start to move the needle towards better supporting kids' mental health. So a couple of the promising practice things we know that work: universal social emotional learning curriculum and instruction to support all kids at that universal level, support all their mental health. As I said, when we're mentally well, we're better able to learn, we're better able to focus, we just do better in sort of all things. Compassion resilience to take care of the adults who are working in those schools, taking care of their mental health and well-being, because they're the ones who are there supporting our kids when they're at school. Restorative practices that are designed to repair harms and teach kids rather than punish and avenge for unwanted behaviors. It is a promising practice. It's something that we know is effective as a disciplinary practice. And I might argue that it's much more effective than suspensions and expulsions. Helping kids shift their perspectives so that they can support each other. Peer-to-peer suicide prevention programs, teaching kids, I think it may be on the next slide, but there are systems and supports out there to reduce stigma. So kids who are struggling or kids who see their friends struggling can get through that stigma, can avoid that, and get their peers, get their friends the help that they may need. And when it comes to, the suicide prevention, that's obviously sort of the ultimate thing that we need to focus on, or not ultimate thing that we need to focus on, but that's sort of the ultimate negative outcome that we, desperately want and need to try and avoid. Here's some more concrete things that we'd love to see schools doing to build and maintain those comprehensive school mental health system, the SHAPE system, and the school mental health quality assessment. Those are tools to help schools and teams, school-based mental health teams, sort of assess and build their policies, procedures, and practices around comprehensive school mental health. Referral pathways to build partnerships between schools and community organizations and community supports to provide things like therapy, medication management, things that we know kids need sometimes. And then the culturally responsive problem-solving process to ensure students are matched with the support they need, again, on that continuum of mental health and wellness. I'm gonna start speeding up a little bit, keeping an eye on the time here to make sure I get through what I need to. So this was not on that first slide in terms of structures and systems, but these are the core values of our trauma-sensitive schools system or framework. It's not a separate the reason it wasn't on that initial slide is because this isn't necessarily a separate program or initiative or a separate thing to set up. We view it as sort of a lens through which we look at mental health and wellness and well-being. That we know trauma and mental health often go hand in hand, and they often have overlap. They often coexist, but not always, of course. But even when it's not, the reason we'd like to make sure or support teams in looking at their comprehensive mental health system, their multi-level system of support through this trauma-sensitive lens is because the practices and procedures and policies that promote trauma-sensitive practices or trauma-sensitive promote supporting students who have experienced trauma or are these sorts of practices can benefit all students. It's not just for students who have been impacted by trauma or have experienced trauma, but the practices within our trauma-sensitive schools can support all students. So I wanted to touch on this because we do want to make sure that mental health teams who are designing systems and setting up comprehensive school mental health programs are looking at things through that lens. Here are some more practical tools like staff support, professional development, technical assistance things that can be helpful to schools. Again, do that perspective shift and do sort of the action or tangible things to put those supports and things in place. Important to recognize here when we're looking at these tools, the reason these are important, student and staff mental health is not the job of the school's counselors, the school psychologists, and the school social workers and the school nurses. It's the job of everyone that works in that school. Mental health is a team sport is a phrase we like to share on our SSPW team quite a bit. So classroom teachers, educational assistants, other support staff, community members all play a role in mental health. So having that mental health literacy, we're not expecting classroom teachers to, sit down and do a, suicide risk assessment or things like that. We're not expecting teachers to be therapists, but there needs to be a baseline knowledge of these things. One, to reduce stigma around mental health. If we're not talking about it, we can't address it. The stigma reduction to help kids seek the help that they need, and that it doesn't feel like it's taboo to talk about it or acknowledge it, so that peers feel comfortable talking about it and coming forward when they see a friend or a classmate who's struggling. Mental health literacy and youth mental health first aid, that provides competence and competence for all staff to be able to recognize signs of mental health struggles, as well as the skills they need to sort of respond in the moment. So along that continuum of services and supports, Everyone is part of that. And a lot of times, sort of the first sort of screener or flag that might come from a teacher teaching a kid in the classroom and recognizing some things. So having that base level of mental health literacy and knowledge, and that knowledge of and skills to how to respond in the moment, are really important. Where do you find such trainings? Here are a few links to some different opportunities. A lot of things that are out there are free. There are a lot of them that are virtual and online. Here are some more. So just really want to make sure you have these resource links. Again, I have limited time today, so we can't go in detail about all this, but I would encourage you to look into these things. These are just all the resources, or not all the resources. These are several sort of key resources that you can access to sort of give yourself a way to implement these comprehensive school mental health systems that I'm talking about.
Hey, Tim, we have a question for you that I'm going to pause you real quick for.
All right.
Says, what advice do you have for helping ASD students who look and sound like the neurotypical, but their understanding of incoming and outgoing communication situations are not neurotypical? How do you get the teachers to understand that what they see is not necessarily what they get, especially when students try to hide their communication deficits?
Excuse me. Excellent question. That I'm going to get into that in just a few minutes when I talk about how we do evaluations and how we develop IEPs. So I'm going to put a pin in that for the moment if I can, but I'll make sure I sort of address that specific example directly as I'm talking about CCR IEPs and evaluations. I hope that's okay to whoever asked that question. So with all those resources, I feel like I just, threw everything but the kitchen sink at you. If you're wondering, so, okay, where do we start? What do we do now? This is very overwhelming. A good place to start, if you've got nothing, is just start with that comprehensive school mental health framework. There's lots of resources. There's lots of sort of information and processes that you can do. There's training that you can attend and take to figure out how to implement those things. And that might be a good place to start, is starting at those sort of big levels. And if you have sort of a infrastructure in place, the next thing you might want to think about is, well, you look at your data. It's probably telling you a story about what's going on in your school or your school district or your community. And just like for individual students, we want to align the right supports with the needs that they're demonstrating. From a universal perspective, we also want to address our needs with the right tools. So let's say you live in a community where there's high levels of AODA, alcohol and other drug abuse, high levels of poverty or violence in the community level violence. Those things that might be that indicate your community has a high level of historical or generational trauma that your community has experienced. The comprehensive school mental health framework or trauma sensitive schools might be the tool to help address that. If you have disproportionality in the students who are identified with IDEA disabilities, if you have disproportionality in your racial and ethnic populations who are receiving free and reduced lunch or who are being secluded and restrained at high rates, culturally responsive problem solving might be your tool. So the idea here is just to use your data to figure out what the root cause of larger struggles might be and how to address it. The last thing I'm going to mention about comprehensive school mental health before we get into those details about evaluation and IEPs is that the Get Kids Ahead initiative stemmed from one of the federal COVID relief funding bills. This is an initiative where every school received a floor of funding from the state to address student mental health. And then there was sort of a equation that was used based on student populations that sort of upped that amount depending on the number of students in the district. So There have been multiple disbursements of this. They have schools and districts, I believe, have until next year sometime to use those funds to improve mental health services for students. And you can see on the slide there those things that are being served. So getting into the particulars of the question that was just asked, I'm going to talk about a couple of things. So I just talked about broad strokes about comprehensive school mental health. And if you're thinking, boy, our school's nowhere near that, we need to get to work on that. I want to make sure I'm clear that you might be traveling down parallel tracks because while you're building that mental health system of supports, there are individual students and populations of students and small groups of students who have needs now that you need to be able to figure out how we're going to meet those needs in the absence of, say, a robust comprehensive mental health support system, or in the absence of a clear referral pathways system in your school or district. So our other sort of comprehensive framework that I'm going to talk about today is the Comprehensive Special Education Evaluation Framework. What we're trying to do with this and support schools and districts in doing is to make a shift from what is the label for this student under IDEA to what needs does this student have and how can we meet them. So what I mean by that is we need to move from, we think this student has autism, let's make a referral and figure out what assessments we need to do to confirm or disconfirm that this student has autism so we know if they're eligible or not. We want to move from that to what information do we need to gather through this evaluation to identify their eligibility for services, or the label is necessary but not sufficient, and identify that student's strengths, areas of need that might require an IEP to meet. So again, the IDEA impairment category, whether it's autism or intellectual disability or significant developmental delay, whatever it might be, identifying that is only one piece of the evaluation puzzle. It's not enough. Special education services are not label driven. They are student need driven. They are individual student need driven. Another thing that's really important is in the federal regulations that are the implementing regulations for IDEA. Evaluations are required to be sufficiently comprehensive to identify the student's needs, whether or not they're commonly linked to a disability category. Now, the example that was shared about the communication of a student, that in the case of autism, that certainly makes sense that is something that's commonly linked to autism is differences in social communication and struggles with social communication and other communication. But the wrinkle that I think I heard that was shared in the question is that label or that thing that's commonly linked to autism doesn't get into the detail about this student also, being human and having feelings and having emotions and thinking through, I don't want to be embarrassed, or I don't want to let the people around me know that I'm struggling with this. That's maybe something that's not commonly linked to autism, that a team needs to evaluate and investigate and figure out the root cause and figure out what services and supports that student needs in order to address that problem, that struggle that student has, that barrier to learning and that barrier to communicate, that barrier to fully participating in the school or the classroom experience. So it all starts with asking educationally relevant questions at the outset of an evaluation. So when a referral is made or when a reevaluation is coming, asking what we refer to as educationally relevant questions. Answers to these questions, and I'll get into some examples of what those might be in a second, but answers to educationally relevant questions, those are going to help IEP teams identify the barriers to access, engagement, and progress in the curriculum for a student. So again, going back to that example of a student who struggles with a certain communication skill, but tries to hide it or tries to mask it for other reasons that may be related to mental health, that may be related to their disability. In the end, it doesn't necessarily matter. What matters is it a barrier to their access, engagement, and progress in the curriculum? And if the answer is yes, the IEP team needs to do some work to figure out why and what to do about it. and then to identify strengths and assets that the student has. So asking educationally relevant questions. So here's sort of a big example that I go to a lot. Something that's not an educationally relevant question is, what is this student's IQ? I've asked this in different trainings and workshops. I've yet to find someone who has a satisfactory answer who can tell me when a student's IQ is educationally relevant. That it's something that we can say, okay, since this student has this IQ, we know that they have this IEP goal and they need these services. That's just not the way it works. An educationally relevant question might be, what is the student's preferred method of demonstrating their knowledge, skills, and understanding? So again, going back to that communication question, whether it's a lack of skill or a lack of generalization or being able to use that skill for social communication, an IEP team figuring that out can really remove some barriers to that kid's learning. We ask our educationally relevant questions through focusing on these skills that you see on the left and not the labels. So we think the student might have autism. Well, we need to do a social communication assessment. We think the student has an intellectual disability. We need to get an IQ score, not the focus of evaluations. So we want teams to consider and think about questions that are academically relevant, or pardon me, educationally relevant in these 6 areas. An example of that when it comes to autism spectrum disorders is what you see here. A team who may be considering autism as one potential area of eligibility under IDEA for a particular student. What you see in the box there is one of the defining characteristics under our PI 11 evaluation rules and the definition of autism that a team needs to evaluate and identify whether or not a student meets. You can get to that answer, does the student meet this? Or as we often hear, how do we check the box? Yes, that the student has this or meets this particular criteria. You can get to that answer by asking educationally relevant questions within the area of academics, within the area of communication, within the area of social emotional learning. It's not that we say, okay, here's the characteristic we're looking at. Let's make sure we have the right, standardized parent questionnaire check or behavioral checklist that allows us to just put some data down to acknowledge that this is a thing. Another thing that we want to focus on with comprehensive evaluations is, Katie, am I correct in that I have like 3 more minutes?
Yep, about 3 more minutes.
All right, I'm going to go fast, sorry. Again, going back to our mental health systems and our evaluations, really need to think about, fixing systems and not kids. And one of the ways we do that is we want to look at all the things that impact our students' access, engagement, and progress. Not just let's assess what's wrong with the kid and we'll fix that with the IEP. We want to look at ecological factors. So those are things within the system. There's not necessarily a tool for looking at ecological factors, but we need to acknowledge that there are barriers external to the student, whether it's their disability or a mental health diagnosis or both, that impact how that student or that child moves through the world. And we do that within our evaluations through this model that you see on the left, what's referred to as the RIDE ISO matrix. We review, interview, observe, and test, but we don't only do those things focusing on the learner. We also want to review, observe, assess things like the instruction, how it's being delivered, how that student responds to it, the curriculum, what's the environment where the student best learns, or where all of our students learn best. Here are just a couple other things that come from specifically in our emotional behavioral disability rule. When it comes to mental health, I just wanted to make sure that, again, in thinking about the IEP team needs to do a comprehensive evaluation that looks at things whether or not they are commonly linked to that particular disability label or category. And we have an FAQ that sort of gets into, within the realm of emotional behavioral disabilities, how mental health diagnoses from outside providers may interact with an IEP team's evaluation and IEP development and implementation processes. So wanted to make sure you have that. Another thing we want teams to be thinking about is, again, there's that confusion when our goals might be aligned, but they might not be aligned perfectly, or they may not be exactly the same. What we want teams to think about, and parents and families and educators to understand, is when a student has a mental health diagnosis, or a student has experienced trauma, or is impacted by a trauma experience, that it's not a rule in or a rule out for special education services. It's not, oh, we know the reason for this student's behavior is because they experienced this trauma, or we know that this student has a diagnosis of schizophrenia, or a medical diagnosis of autism, or a clinical diagnosis of autism. Those things, that information, when there are official diagnoses or evaluations, need to be considered by the IEP team. And in a practical way, this is what I mean by that. A psychiatrist or a private practice psychologist, perhaps a community-based psychologist, might diagnose a student with depression based on identifying feelings of worthlessness or excessive inappropriate guilt nearly every day, diminished ability to think or concentrate, or indecisiveness nearly every day. Those are DSM-5 indicators of depression. If you think of that in the context of educationally relevant questions, there's nothing particularly actionable in that, or anything that's necessarily educationally relevant, unless through our comprehensive evaluation, we look at it in a different way, where we look at teacher, where maybe our evaluation indicates that teacher, parent, and student interviews identified frequent negative self-talk by a student. That's actionable. We can make an IEP goal around that. Observation data indicates a pattern of difficulty focusing during individual work time. That's actionable. That's an educationally relevant question, an answer to an educationally relevant question that fits into some of our IDEA education. So really short, I know I'm a minute over. I'm going to go super fast through some CCR IEP stuff. So, but in summary, again, your evaluations, the evaluations that teams are doing need to do both of the things that you see on the screen here. It's not just whether the student meets criteria or not. That's the base. That's the minimum. That's not even the minimum, because it's not enough. It's necessary, but not sufficient. We need evaluations that help us figure out what services and supports that student need. What goals are we going to have for a student? So now tying the three things together, our comprehensive school mental health system, our comprehensive special education evaluation, now we tie that to our college and career ready IEP. So this is where the rubber really meets the road with, again, that question about identifying what it is that's the barrier to that student in the question, that child, what is the barrier to them communicating? If it's a social communication thing related to the autism, that's going to be a very different set of things written in the IEP when it comes to their present level, what goals you might have for them, and what services and supports they need, than if it is more of a mental health related thing where it has to do more with anxiety or embarrassment or some of those social emotional things that are a barrier for that student, that makes them feel like they need to mask that or hide that. Because if you write a goal that tries to improve a student's social communication skills, when in reality they have them, they just don't want to use them for whatever social, emotional, or mental health reason they might have, those IEP goals are not going to be effective. So it's really important through that comprehensive evaluation to get to that, what is this student's needs and what services and supports, and now those services and supports need to go in what we call a college and career ready IEP. So real briefly, I'm going to take 2 more minutes. I hope that's okay, Tim and Katie. We have a couple other good resources when you're developing IEPs. We've got some great resources on inclusive strategies for students with IEPs. So this is how general education teachers, support staff can support students with IEPs in the general education environment. It helps them examine their biases and beliefs about students with disabilities and their behaviors. It has things for how to build relationships with students, which we know are so key. Positive behaviors intervention supports are required for students whose behaviors impede their learning or the learning of others. Those need to be in IEPs. I'm really sorry for going through this so quickly at this point. It might be a requirement for students with autism developmental disabilities to receive these things because it is a question of faith. Does the student needs certain supports when it comes to behavior, social emotional learning, mental health, in order to receive a free appropriate public education? How you do that is through this 5-step CCR IEP process. So when we say understand achievement, that might be looking at that communication example that was shared of what are the students' true communication needs and their true sort of root cause or the true barriers to access, engagement, and participation in the curriculum. And that's what we then know sort of what the effects of the disability are. What is the outcome? What is the problem with that student not having the ability to communicate in the way they need to in the classroom or while they're learning? And then you build goals around that. And then we align those services, and then we continue to watch their progress. So that comprehensive evaluation should be tied very closely to the individual education plan. And if you've done a good comprehensive evaluation, the plan should be designed to meet those particular needs. I'm not going to touch on behavior intervention plans other than to mention that we will have some technical assistance and materials coming out soon when it comes to functional behavior assessment and behavior intervention plans that may be attached to an IEP or an evaluation. I was going to touch on some specifics about specially designed instruction. I think for the most part, these are hopefully pretty self-explanatory. As I said, I'll send this slide deck to Tim, who can send it to all of you who are here this morning. And I'm sorry I had to rush through all that at the end here, and I'm well over my time, even though Tim let me start early. So I kind of want to tie this all together by saying this. I started talking today about why we're all here and the link between autism spectrum disorders and developmental disabilities and mental health and intersectionality. I want to share why I'm here. The picture you see on the left is me and my son. I've never seen Tim Markle without a beard. I suspect he's never seen me with this particular haircut. And now you see why. In May of 2022, my son that you see there was diagnosed with lymphoma. But there's so much more about him that his teachers know and that his school supports that are important to him. But the reason I wanted to share this picture is because I also mentioned about how a lot of times parents and families are the seams or the stitches that have to tie our different siloed systems together, and how exhausting that can be. I'm a school psychologist. I know a fair amount about mental health and social, emotional, and behavioral functioning. My wife is a PhD in population health sciences, and her area of specialty is informal caregiving. So people who take care of children with disabilities or neighbors who are struggling with chronic disease, people who take care of others without getting paid for it. She is literally an expert in that. And we are now, since May, living that. And I am now living and doing things with my son that I do for a job. And boy, we still struggle. It is stressful. It is hard. We have every privilege, every advantage in the world to support our son. And it's still really hard. Getting him to take giant horse pills that have chemo medications in them is a struggle. I have tried every school psychologist behavioral trick I know with this kid. And we're to a point now where he's doing well. So my point here is, one, self-care of those of us who take care of others is really important. So don't skip over that compassion, resilience stuff, taking care of your colleagues and things. And, remembering that when we're doing evaluations with kids, we are more than those labels. That there's intersectionality. There's a whole bunch of pieces that make up who we are. If you treat my son as the kid with cancer, he gets mad. If you treat someone as autistic without really getting to know them, getting to know the other components of them, doing a comprehensive evaluation to figure out things like, what is the communication barrier here? Is it truly autism related, or is it mental health? The things that really help my son, the things that really help kids in school are the relationships, are getting to know them, not the things that are on the tests and assessments that we do. Those data, those labels, they don't define who they are. That's why it's so important to do those comprehensive evaluation, to look at those IEPs through educationally relevant questions and answering those and really meeting kids' needs, not their labels. So with that, I am 10 minutes over. I am so sorry, Katie and Tim, but thank you for the extra time. And that is all I have for you today. I went through it very fast. If you have follow-up questions or would like to have further discussion, here is my contact information. And with that, I'll pass it back to Tim or Katie.